Recording in progress.
Hi, Mike. Are you ready? I'm gonna have Donna come up, and then we start from there. Okay.
Welcome, everyone. Thank you for attending today's webinar. My name is Donna Chow, and I'm your host and moderator for today's class by eLotus, your leading provider of TCM continuing education. We have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content. With over 200 speakers, 700 courses, and 3,000 hours of continuing education. Today's webinar is Fundamentals of Trigger Point Needling and Neck Pain, presented by Dr. Michael Sakowicz. Before we begin, let's do a little housekeeping. Today's webinar will be from 9 to 6 p.m. Pacific time, and we will have 4 breaks. Our lunchtime will be from 1 to 2 p.m. If you guys have not done so already, please get your copy of the lecture notes from the Blue Course Access page in your account. If you'd like to join the chat, please do the following right now and set your chat preference to everyone so that everyone can see what you're typing. You'll have to do this manually because by default, the setting only allows the speaker and staff to see what you're typing. If you have any questions during our presentation today for Michael, please type them directly into the Q&A box from your Zoom control panel. Michael will answer your questions as time allows. The quiz and video replay will both be available tomorrow, and you will receive an email notification when they are ready. All right, guys, our speaker today is Michael Sakowicz, who has been a practitioner of acupuncture and herbal medicine for almost 20 years. After graduating from Southwest Acupuncture College, he trained in orthopedics and rehabilitation at Tri-State Acupuncture College. The training addressed a variety of needle techniques aimed at assisting the body in recovering from pain. And among them is a needle technique that is quite similar to what we know here in the West as dry needling. Michael has been actively involved in trigger point needling since that time, assisting a large number of people in overcoming acute and chronic pain. All right, Michael, go ahead and please take over the screen now and share your PowerPoint.
Okay, thank you. And good morning. All right. I hope everybody can see what's happening here.
Not yet.
Not yet?
Still see the video, but not the PowerPoint.
You don't see the PowerPoint. Huh? That is bizarre. All right. Nothing?
Not yet, Michael.
Still
Did
not.
you
Huh.
try to do the screen share again?
Okay. Oh, no. Okay, let's see. Oh, man.
Did you click on done on the little?
Oh, I see. Okay, I did not see that. Okay. Hurrah.
Perfect.
Okay. Thank you, Sam. And welcome. Good morning. And thanks, Donna, for the wonderful introduction. Happy to be here. And we have a lot to talk about. I'm excited to share all this stuff in a larger format. So we don't really have to rush. We can really talk about the in-depth about all this wonderful information and take a deep dive. So let's get into it. So as was said earlier, I went to SWAC in Tri-State. When I was at SWAC, I had a really great, not only some really great mentors, but great classmates too. One was Andrew Nugent Head, who, if you know him, he spent a lot of time in China and really digging deep into tradition, like really old traditional Chinese medicine. And so it was really a unique experience to be in class and sit next to him. And, while the teacher was presenting, going, oh, but this is the deeper idea of what that is, or, it gave me a closer look into sometimes why we, like what the classics were saying and how things get diluted into, how we think of things now when we read, certain texts. But anyway, that was a really unique experience. And I've learned, a lot of these needle techniques through him. And so that was really great. But further on in life, I had, when I lived in Boulder for many years, Colorado, and I saw a lot of sports acupuncture there. I saw a lot of yoga injuries. I did that for quite a while, and after that, I moved to Providence, and I worked in a clinic there, and we saw a lot of internal medicine. So at that time, the internal medicine stuff really took over, and I didn't really do much trigger point needling, even though it was a fairly fresh in my mind when I had moved there. I'd only been doing it for a few years. And then so to go from that to doing almost all internal medicine, that was a definite step in a different direction. We did a lot of, meridian balancing type, Japanese style acupuncture, and just had a really great experience there as far as learning how to manage patients, because that is really important for us to be successful. Not only for ourselves, but also, to have success with patients and get, better recovery for these individuals, right? So that was really helpful to get on track with understanding that. After that, I'm moving around a lot. I moved to Atlanta, Georgia, where I'm at now. And here I would say that I moved into a clinic that does primarily pain medicine. The gentleman that has been running that place for the past 20 years or so, he he's been doing a mix of acupuncture and trigger point release technique. And so it was just a really nice fit for me to go in there. So, currently I probably see 70% of my patients there are pain related, and I'm not doing necessarily trigger point work with every single one of them. There's cases where there's just a lot of hypersensitivity, maybe some fibromyalgia type things, things where they're just really sensitive, so you can't really do as deep of work. And some people are just sensitive to this stuff, as we'll talk about as we get going here. And the other parts of, in practice is, let's say, the other 30%. It's a lot of, sleep disturbance, anxiety. I think that since the pandemic and all that has transpired there, the amount of people with just, anxiety, depression, sleep disturbances, that's really gone up, and it's really been a big part of our practice. And even with our pain patients, we still have to work with that, because being in pain can cause a lot of emotional disturbance as well. One story that I like to really that helps me set this apart is when I was doing all this training in this work. I was in Denver, and I was treating patients in Denver. I had this one guy, and I was doing acupuncture, moxibustion. He had some very chronic knee pain, and very stubborn. No matter what I did, it would, feel good for a few days, and then it would come right back. And I treated him pretty regularly for, let's say, 6 weeks or so. After that, I started learning some of these trigger point stuff. So I came back and I said, hey, let's try this thing out. So I hit him in, basically got vastus medius to release, medial quad type stuff. And I got a few good releases in there. And, suddenly, next week he came back and his pain was markedly better. He had improved a lot. And then after 2-3 more treatments, I didn't see him again. So he was just better, and that's great. And so my point is we can get more profound results with this type of work. It's rehabilitative. It's a little bit deeper, but you have to get through it. And getting through it there's sometimes a trick to that. So, goals for today. We want to figure out, trigger point identification, palpation skills, patient management, good techniques when we're needling, confidence in the entire process, and skills to build upon. I would like to say that this type of work, for some people, it's going to come very naturally. And for some people, it's not. And it's a really simple thing to kind of get, really dig your claws into and start getting results very quickly. So it's sort of easy in a way, but, kind of getting to that next level of mastery, if you will, that takes time. And a lot of it does take a lot of practice and understanding muscle systems and fascial systems, because all of this goes together. This is not only are we looking at the muscular systems and fascial systems, we're also taking away what we've learned from our Chinese medical backgrounds, right? Because meridian therapy is also very powerful. And I do use a combination of all these techniques with my patients. And, one thing is we're always learning, right? I had a really interesting patient yesterday. She came in. I've been seeing her for a little while, maybe 4 visits. And she has been dealing with some deep hip pain all around her pelvis. But it was all one-sided, right? And so she's been making good strides. in the right direction. We get to a point where, she's just finding things to be really stubborn in her hip, but she did come in with leg and some foot pain and some different upper back stuff too. And we're just kind of clearing out all this stuff, right? But one thing was a little stubborn, and she gets on, she's 49, she gets on hormone replacement therapy, and her hip pain goes away. I learned something, she learned something. So, there's certain things that we can't, discount. And maybe, after some time I would have broken through that, but the hormone therapy really worked wonders for her. And so now we're working with like some really stubborn toe pain that she had a surgery on. So we're working with that. So, it's my point is always learn. You can always learn more. And we can just keep going deeper and deeper with this stuff. One thing is almost everybody has pain, and a lot of us, we can block some of it out. When you have chronic pain, it kind of filters into the background. Somebody who has been having chronic pain for 20 years, they might not even really think about it that much. It's there, they're aware of it, but is it something that's constantly on their minds? Not necessarily. However, if this pain starts affecting their mobility, or if somebody has been very active, for their lives, and suddenly they sprain an ankle, knee, or have, a bad hip or back injury, it sort of immobilizes you. And so when you are used to being this person that's always on the go, and then suddenly you can't do that, what does that do to your psyche? Really, it's pretty, it can have a really strong impact. I've had a few patients that have told me that they feel like they're a prisoner in their own body. It's a really, think about what that means, right? They're a prisoner in their own body, which means they're not able to do a lot of things that they want to do. They might have had, they might want to travel the world, but they can hardly walk, 20 feet without suffering for it. That's, it's pretty real. I find a lot of, people with, pelvic pain disorders. That stuff is really difficult to treat, and it can be very persistent, and it can affect, people's lives in a wide variety of ways. And, that is one of the more common things when people feel that way, like prisoner in my own body. A lot of times it's some type of pelvic disorder, and it's a lot of problem solving. But we'll get more into that later. But my point is that it can make us depressed, anxious. It can lead, and often, it leads to substance abuse. The opiate crisis. People will drink a bottle of wine every night just so they can sleep. It's common enough. And it is relatable when you have a sudden onset of pain. And I know that some people can relate, and I know there's a lot of people that maybe have not gone through that part in their lives where they've really had something that just stops you dead in your tracks, where you can't really live the life you want to, or you have to cancel a trip, because you can't walk, right? So that is it can be deeply profound how much that affects you. One thing that, just a note, a lot of us will have patients that have this idea where we're like, we have a patient that will say, oh, my back pain, my hip pain, my something. They start identifying with their pain as part of their persona. You have to be really careful with those individuals, because their pain is part of their identity. What happens if you start stripping their identity? It ends up being pretty tough to work with those patients. But in that case, maybe we'll start suggesting counseling or something like that to help them work. Hypnotherapy. There's lots of stuff out there that can help with that type of patients. I've sent patients to EMDR, which is really a fascinating work. If you ever had that, it's pretty cool stuff. So acupuncture versus dry needling. It's all acupuncture, right? We're using an acupuncture needle. As Donna said earlier, I started with this work as a group of acupuncture techniques. So in this post-grad course, there was at least eight different acupuncture techniques that we went through. And some of them were very subtle, where you're just slowly coursing qi, very gentle movements with a needle. There's things that would seem like, cooling the mountain and, warming techniques and things like that, right? And then there is this ashi needling. And I think somebody even translated it as, sparrow pecking technique or something like that, But anyway, it's all different words or different terms for acupuncture, right? So, PTs will sometimes get upset with us calling things dry needling. We get upset with PTs doing dry needling. That's a whole other topic for a different day. But what I find is I'll have a patient and they'll come in, they say, oh yeah, I've had dry needling before, let's get to it. And I'll go, okay, great. And I've learned, but a lot of times patients will come in thinking that they've had this needle technique when really they've had, e-stim acupuncture. Or sometimes it's just straight acupuncture with very little stimulation and so patients will come in off the street having really no idea of what trigger point release is, but feel fully confident that they are pros at it, right? So that is something where when I have a patient that's had dry needling from PTs, I ask them to describe what their experience was. And if they've had acupuncture, more like traditional acupuncture, what most of us are doing in the States, just leaving needles in for 20 minutes or do e-stim acupuncture, I will correct, that thought with the patient. I will correct that and say, look, that PT was doing acupuncture, very traditional acupuncture, as far as, we're concerned, right? Now, then I will describe to them that, what we're doing is going into a trigger point and you're going to really feel what I'm doing. And, explain to them the process. But for our purposes, I find that, when I came to my current practice, that practice was really advertising dry needling by acupuncturists, right? That is upsetting for some acupuncturists. It's upsetting for some PTs. But what it really does is it's great for advertising, right? If you want to get people inside in your door, you know, you can say trigger point needling, and some of your patients will know what that is. But if you say classical acupuncture technique or ashi needling, that's not really marketable. Not anywhere that I know of. Maybe trigger point needling might be relatable, or trigger point acupuncture. Some people might be able to come off the street and say, "Huh, okay, I think I can get. I think I understand what we're saying here." But you know, but a lot of patients will not know what that is. You know, when I first started doing this stuff, I was practicing on different patients. You know, I was practicing on myself, and I was calling it ashi acupuncture. And then one of my patients goes, "Oh, wow, this is dry needling." And I said, "What the heck is dry needling?" I had no idea. And quickly, you know, I learned what dry needling is. And I said, "Oh yeah, that's pretty much what I'm doing." And so now I'm pretty comfortable, and I use it interchangeably. But when I'm talking with my patients, they identify what I'm doing as dry needling. So I just call it that. And it's, you know, it's simple enough. But some people do really get hung up on the terms. But I don't, I guess, is my whole point. And so I will use terms interchangeably as we go forward here. And you can make up your own mind what you want to do about it. But let's see here. I find that when we start with these techniques, there's a lot of acupuncturists, you know, especially depending on what your background is, where we're just so reluctant to cause pain. There is a lot of times when we'll get that dachi sensation, right? That deep ache. Oh, that's good. That's what we're going for. You know, that's a lot of times what we'll tell our patients. And when we're doing this type of, you know, acupuncture, it is, when we're talking dachi, it's a lot of that deep ache sensation, followed by yet a surprise. And it can have a lot of sensation. So I like to more or less inform my patients what they're going to feel or what they're likely to feel. So generally, if it's the first time, I'll say, look, it's going to be a little achy at first. And then there'll be a surprise. And, you know, getting used to that sensation takes some time. Some people get it right away. But I would generally tell my patients that it should not be painful. But there's a lot of sensation, right? And depending on which area that you're working in has different sensations. And as you work with patients, and as hopefully you are worked on with this, you know, if you really choose to dive into this type of acupuncture, you know, you will really be able to understand when you're worked on or working on yourself, perhaps, you know, oh wow, that spot in my leg is that's really sensitive to have worked on, or, you know, upper back is really bad. I think different people have different areas where they prefer to not be worked on, but sometimes we just have to get through and you know, have different things worked out, because as we do this work, you things come up, and we might just be working out or walking down the street and tweak something and have to, address it pretty quickly. But I do find that, legs are really uncomfortable. It's just the muscles are just so dense there. And there are some times when you'll have a patient that is just really good about, getting, they've been on your table many times and they're used to getting all these muscle twitch, fasciculation type stuff. And they're very accustomed to it. And then they might come onto your table one day and maybe they're having a, fight with their wife or husband, bad day at work. Maybe they just had a close call in traffic on the way to your office. And so they could be really sensitive. Stress makes people very sensitive. Could be very, surface level tension. Also, hormones can play a big part of how sensitive people are. And so even when I have patients that are very accustomed to being needled, sometimes you just get in, you'll get 2 or 3 good releases and say, oh, that's it. Let's not do any more of that. And if that's the case, we would just switch gears. Maybe I'll just suggest doing some acupuncture or shiatsu or cupping, gua sha, whatever. Still want to achieve our goals for that patient. But a lot of times it's not worth pushing our way through because you could just do more harm than good. And a lot of times if you push your patients through a situation like that, it's not going to be good for you or them. Learning through my past experiences, you could say, I'm going to learn from that guy and not push my patients into doing something, even though I think it might be the best for them. In the moment, they can always come back tomorrow, the next day, when things are settled down, or maybe you can kind of work it out in the moment. Some sensations that we do really want to avoid, though. A lot of times when we're doing just getting a needle in, you can get a lot of stinging, burning. I always go back and forth with my patients, be really clear with them to tell me, wow, that's really uncomfortable. Why is it uncomfortable? It's because sometimes that uncomfortable is just a really strong duchy. And I will inform that patient that that is a normal sensation. And as long as they're okay with that, we'll continue. But there's a lot of times when I'm needling, I'm kind of more or less probing along, looking for that trigger point. And sometimes when you're in one location, you can move that needle into multiple angles to find different trigger points within a very small area. That can be a little uncomfortable, but it really does get really great results. But when you're doing that, you can sometimes hit some, dendrites or axons or something that creates a spark, like, wow, I just got a really weird burn sensation, or stinging, or something that's really biting, that sharp stabby feelings. When I have a patient telling me that, I'll pull that needle out, and if I feel like I have to go back into that location, I'll just go maybe even, a couple of, millimeters off, or quarter inch off that, and try it from a different angle to better access that trigger point. Because a lot of these trigger points that we're working with, you know, it's something to be said for, it can be very precise, but there's also a lot of different hand techniques that you can use to get to that area and avoid more discomfort that's been necessary. But yeah, we'll talk about legs and abdominal stuff a little bit later, but it really is very uncomfortable for a lot of reasons. All right. So how does it work? This is a really tricky answer, because there's not a lot of science out there on why this type of trigger points needling works so profoundly. You know, Janet Travell has a huge section in the beginning of her, you know, Travell and Simmons book. You know, they just have a lot of science or, you know, ideas of how it works, but when you go through actual really looking for different clinical tests and things like that as to why and how it works, you're gonna have a hard time finding things. At the very end of this slideshow here, at the end of your notes, there is a link to one of very few studies that I found. So look at that. You know, I don't want to go too much into that because it is, you know, very dry. And it's not really the point of what we're going to talk about here today. You know, I'm here to talk about technique, not, you know, cell structures and axons and overloading axons and all this stuff. But I will say that one way that it's been described to me is that you are oversensitizing, you know, a trigger point and, you know, something that's already stressed out. And when you're pushing it basically into a the red zone, right? And then you have your release, your fasciculation, right? To us, you know, I find that when we have these types of reactions, we have, not only are we getting that, you know, strong chi movement, that local chi coursing, shall we say, but when you have that deep muscular release, that is strongly moving blood, right? There's no way that you could say that it's not moving blood, because when we have that that fasciculation, it's basically pushing out all that bad blood that's locked up in the muscle and lets all this good blood come in and feed that muscle again. Not to say that the muscle isn't getting blood flow, right? It'd be necrotic if it was not getting any blood flow, but it's not as vital as we want it to be. You know, when you get down into that, you know, cellular matrix, you know, you are, you know, that's the part of our bodies where there's a lot of exchange of, not only is there a lot of nutrient in there, but there's a lot of waste in there too. And so that flows out and gets processed further, you know, through our blood work, through our lymph, all this stuff, right? When there's a lot of stagnation in a particular muscle or muscle group area, you're gonna, that matrix is just gonna be full of waste, basically, you know, because like your cells in your body, like big picture, right? We have to eat to get nutrition, and we have to poop out the bad stuff, right? And you know, as is big as is small, and down to the cellular level. And so when you have in a muscle group, all this gunky stuff, all this waste, basically, you get that fasciculation. It pushes all that stuff out and lets good, nutrition, blood, oxygen to come in, and that is what rehabilitates the muscle to basically get deeper healing. That is more or less what I believe. And again, the science is a little tricky on that. It's not really clear. Now, when we have, our whole body is wrapped in fascia, right? Everything. There's this, connective tissue that connects every single piece of our body. And that's all made up basically of collagen, right? And so, it's something that it's not something that's going to move like a muscle will. But if you have a lot of muscles that are tight along a line, say, it's going to create a pulling on the fascial body. And that is what distills down into causing different pain patterns. And so we're going to get more into that as we go further. But it's something that, you have to always be kind of thinking of as a big picture, right? Because you have local muscle that we're working with, and then we have to look at the longer fascial lines of the body, where something in your low back or hip can affect a neck or a mid back, something like that. Just making sure we're covering everything that I want to here. But yeah, looking at the big picture is really important when we're engaging with people here. Weakness versus tension. So when we have a patient that is in some type of pain, and a lot of our patients are going to physical therapy, and the physical therapist will say, well, you're weak here and there, and we're going to build you up, build up your muscle strength in this said area, right? And there's absolutely nothing wrong with that. I think it's all good and sound. But a lot of times what I do, try to tell my patients, again, is that, because of a muscle strain, the muscle strain itself is going to cause that weakness, right? So, and what I mean is that a normal muscle, when a muscle fires, it should be going, as far as, strength goes, 0 to 100, whatever your strength is as a person, right? As an individual, because that's very individualistic there. Your muscle should go 0 to 100. But if you have a muscle strain that's causing, that muscle to only get 40% or 60% of its range of use or strength, then that is going to cause weakness, or that sense of weakness. So when we rehabilitate those muscles, we basically give that muscle its full range back. So kind of getting these trigger point releases, you'll get that 0 to 100 again, because you want that, you want things to fire. And sometimes, of course, we all need to have smooth movements too, but that is the difference between, to me, having that weakness and strength. And it's not always just as simple as that, of course. There's a lot of different situations where that can cause that weakness, but more often than not, I find that it's just that muscle strain, is that muscle is not integrating into the muscle group as well, because it has trigger points, and that's what we're after. Staying hydrated. All right. Who can be needled? This is a fun one. I would say almost anybody can be needled as long as they tolerate it well. But not everybody tolerates it well. I have a wide range of patients. And from very athletic people to people that are, just not athletic at all. But I would say that almost anybody can be needled. Some people are really just hypersensitive to it and they just can't tolerate it. And it takes some time to pick those people out. And some people will get on board with it. That's the reason why at the very beginning steps of this stuff, I like to go very slowly. I'm not rushing, I'm not pushing somebody into have trigger point release on their first visit unless they come specifically for that. However, I have a lot of patients that will come in with pain thinking they're going to get acupuncture. I'll do acupuncture on them, of course, and kind of get things to smooth out. And then I'm going to say, well, look, I found a few trigger points in this area that's giving you a hard time. So I'm going to walk you through some dry needling and see how you do with it. We're going to go very slowly and just kind of walk them through the process. And some people are like, please never do that to me ever again, or I'll hate you. And then some people are kind of on the fence about it. Maybe we'll try it again next time they come in. And some people are just like, wow, this is exactly what I need. And I know it. And let's do as much as we can of this today. That is a wonderful thing, because those patients, if they respond really well and they're very comfortable with it, they will, they'll get better pretty quickly, tends to be. Now, pediatrics. So I had, I do treat, most peds that I have tends to be less pain. It's more, digestive related things or ADHD, that type of stuff, right? But what I do find is that the world that we're living in now, even, junior high, they're pushing these kids to be athletes. There's very little time for schoolwork because they're working on whatever sport that they have. I had a 12-year-old. He was really serious about his tennis game, and apparently he was really good at it. Really good for him. And he tweaked his arm. He had like a tennis elbow thing happening, and it went. It crept, back. It was sort of like a tennis elbow thing, but it crept up, basically the back of his arm into the top of, his shoulder, and a little bit into his neck. And he was really funny because he was excited to try acupuncture. And then, he was all about the Google. So he was looking all this stuff up, and he's really excited that I did dry needling too. And so, so I was just surprised at how excited he was to be needled. So I took a smaller needle than I would than I would an adult patient, and worked very slowly with him. And he did great with it. But more often than not, your peds are not going to want to deal with it because they don't want to deal with needles in general, because needles are scary, right? Most adults don't want to deal with needles either because needles are scary. But that's an example of, you can treat younger folks, if they're, 12 is as young as I've needled. I don't know if that I would needle somebody that is younger than that at that point. I don't know. But I always take it, of course, case by case. Elderly is another thing where, it depends on the person. I have, some elderly patients, let's say 70s, early 80s. I've even had early 90s that I've needled. But these patients are, very active. They're not sitting at home drinking tea in their rocking chair, as some older people might do. But they're out there, they're, doing yoga, they're doing dance, they're going for walks every day. Some of them are more active than I am. And, I wish I had the time for all that. But a lot of times with elderly patients is, you have to think of the elasticity within their bodies, right? Especially if you're working in their upper body, because you don't want a pneumothorax. Nobody wants to deal with that, obviously. And so, you just have to be really thoughtful about those patients. So keep that in mind. Pregnancy, don't do it. Over the years, I have needled a couple of women that were suffering from migraine. And they were, deep, they're in their third trimester when I was doing this, right? First trimester, definitely not. But I would say just don't even mess with it. I really just don't. I don't do needling on. It's just a lot of sensation. And so I usually will just encourage them to do acupuncture, massage techniques, cupping, gua sha, all that type of stuff. It's way safer. If it's in their last couple of weeks, but I would just say avoid it, because we don't need to do harm to that situation. We don't need that overstimulation. So constitution, general health, obviously, I find that, you can have, all different types of people can do really well with this type of work. But you just have to start slowly. I do have a lot of people, that are, let's say, 30s to 60s, that are, especially once we get into our 40s and 50s, we're going to start really pushing our bodies to stay in shape. And when we're really trying to stay healthy and at that age, it's really easy for us to just have a little mistake, or, there's maybe some sports that we did in, high school into our 20s. And when we're, 40s and we're kind of bring it with that same type of vigor that we had in our 20s, it's really easy to, have some injuries and mess ourselves up. But you never know. Sometimes I had this one patient. He's a bigger guy, and he had hip pain for 4 or 5 years, something like that. And he came in, and I really didn't think that he was going to do well. And I thought it was going to take a lot of time. And after 2 visits, he got better, and he was like, I heard from a friend of his that, that comes to me more regularly, that he was out in Japan doing all this hiking out there. And I was like, amazing, after 2-3 visits, to have that stubborn hip pain just go away. Now, the thing with your, deficient, hypersensitive patients is, go slow. Don't do a lot of needling on them. Or, I will start with acupuncture, regulate what's happening a little bit, best we can. Maybe needle a spot or two, and then perhaps we'll do some oxybustion on them, or some, if you're privy to this, doing some, like qigong type massage techniques, that type of stuff, is really great with those deficient patients. You can get a lot of great results just doing, very, very, more or less coursing things with them. Can be really powerful. And the intensity of needling can be controlled in most situations. It just takes time to figure out what that means. And that can be different for everyone. Okay. So it's a little pick up from Google here. So, trigger points, discrete, focal, hyper-irritable spots located in a taut band of muscle. Spots are painful on compression and can produce referred pain, referred tenderness, motor dysfunction, and autonomic phenomena. Okay. Interesting. We're not too surprised about those things. We've all seen the trigger point patterns, where the, from the Travell Simmons books, where they have the X with all the red referral pain stuff. That is all, we don't have to explain too much of that stuff. We all know that. Motor dysfunction, that can be kind of back into sometimes weakness. Sometimes you'll have patients where they can't pick up their coffee cup in the morning because they have, so many trigger points in their arm that they don't have smooth movements. So they don't have strength. Autonomic phenomena. That's an interesting one. I look at that again. There's a lot of like pelvic floor dysfunction. That's where I see most of that autonomic phenomena, because you can have different types of you could have different urinary problems, bladder control problems, erectile dysfunction for sure. And a lot of different neuropathies can also come from pelvic floor dysfunction. A lot of times, women and men can have different sensations, but very strong sensations in their sexual organs. And this type of work can do a lot for them. Another autonomic phenomena that I've seen was I had this patient who she had an airbag. She had a very minor car accident, but her airbag smashed her face, right? And then she wasn't able to, her eyes stopped producing tears. It's bizarre, So she was constantly with the eye drops and things like that. And so I tried some really, I thought doing a really basic like meridian therapy type work with her, I thought that would be really powerful. And it didn't do anything. And I gave that 2-3 shots and I said, well, you know what, let's try something different. And so I started needling areas in her occipital. And I hit some spots, like basically got into her temples and got some pretty good results. And over the course of time, we did a lot of spots, like on her, all these muscles in the scalp, some things around her eyes, kind of all around her jaw. And over time, she got better, and it was pretty cool. And that was a learning experience too. It's not too many people that want all that needling in there. So, Chinese medicine, we have many ways of defining pain. More often, it's going to be trauma, right? Blood stasis, qi stagnation. That's all, very straightforward for us. And there's lots of different techniques that we've learned, that we've used over the years for this stuff. So, I'm not going to find a lot of, I'm not going to go into this in depth. But I would say that most patients coming in, it's going to be some type of trauma or muscle strain, basically, and that may come from trauma. It may not. Environmental influences, things like that. That is something that it can sometimes be a mixed bag, because if you have an environmental influence, cold, right? Let's use that, a cold damp. A lot of times that's going to attack our areas of weakness, right? So because there could be some trigger points in that area, that is sometimes, worth considering, to do beyond just, maybe some warming techniques and herbal medicine that warm their bodies and, clear out the damp and that stagnation. Doing a little of this and that is, the best thing, but you have to figure out the best thing for those patients. I have a patient, she's kind of like a long haul COVID, and she has, she came in with very heavy legs, brain fog, just heavy body, very poor appetite, tons of bloating, so you're like, okay, cold, damp. And she also had a desk job. So she was, she's like this all the time. So she was a mixed bag, right? I gave her, I tried a couple of different herbal formulas with her. She worked really well with Wambitong and doing meridian style acupuncture. And after a few visits, we started just really targeting the trigger point stuff. So really, hitting her traps, levator, getting that stuff to clear out. And she did really well with it. And, the thing is, we have to be really dynamic as, practitioners. We have to be we have to be on our toes. You have to discern what your patient needs within the best of your ability, right? And, if you're not sure, you just problem solve it. You go one step at a time. How do trigger points develop? Okay. So, trauma is really the thing, right? Auto accidents, slip and falls, depending on where you live. Right now, there's leaves falling everywhere. I've had a 3 people in the past week have accidents from slipping on leaves or clearing leaves off their roof, slipping off their ladders and things like that. So those get, pretty interesting. We have VA patients. Those individuals, they can have all different types of trauma, obviously. And oddly enough, I have a lot of VA patients that will have injuries from basic training, because basic training, they might not be fit at all. And now they're being made to run long distances with, 40 pounds on their back, and do all these weird movements that their body's not used to. And they could have, enduring pain because of these situations. So, so that's definitely, you know, a major thing. Again, sports, you know, a lot of times I can have a patient in their 30s and they'll be like, gosh, I don't know, you know, where this came from. Where did this back pain come from? And, you know, or shoulder pain. And you know, a lot of times it's when you're younger and you're really pushing your body to perform, right? You're going to develop trigger points over time. Now, when we're young, our blood is vital, right? We have, you know, we're strong. We have a lot of elasticity in our bodies, but as we age, of course, that's gonna wane. And so, when we are of the age when we're, you know, strong and vibrant and elastic, we can still develop these trigger points and have them not really catch up with us until we're, you know, helping somebody move a desk, you know, helping somebody move furniture, or, you know, I often, bizarrely, you know, it'll be, you know, some guy picking up a box of cereal off the ground for his kids or something like that, you know, and then, ooh, I can't stand up straight anymore. They tweak their back, you know, but how would that happen for just such a simple movement? It wasn't that simple movement, right? It was what led up to that. And maybe they were doing a bunch of deadlifts the week before. Or maybe they're playing, you know, some full contact sports, you know, playing hockey or football when they're younger. You know, it's really difficult to say what that, you know, trigger was that made their back seize, or, you know, whatever that pattern started. But a lot of it is, you know, that type of, you know, I think it's a worthy consideration. You know, baseball players, a lot of times they'll come in with shoulder pain if they played, you know, high school baseball or softball, right? Obviously, overuse, posture is huge. So, you know, some people just don't hold their bodies up very well. It's a struggle for many people. And what I tell people is, you know, just really pay attention. It's really easy for a lot of us to be, you know, even, you know, as at an acupuncture office, and you're working, you have patients all day long, you know, you're on your 7th, 8th hour, and you've had a stressful day, your posture might start getting pretty poor. You know, we get tired, we get lazy. But these types of things, you know, it could be worth setting timers, right? I tell my patients sometimes set a timer every 30 minutes or an hour to check in, take a deep breath, check your posture, you know, like tuck in your neck, you know, straighten your spine, drop your shoulders, observe where you're holding tension. So that's important. Bed and pillows, you know, it's tough finding a good pillow, right? You can spend hundreds of dollars trying to find the right pillow, or bed for that matter. You know, it's kind of a big deal. Some more difficult situations are, you know, old injuries. People will get compensation in their bodies, and, you know, could come from how they hold themselves, how they walk, and then you can have structural anomalies, right? These are wide ranging, very wide ranging. And, you know, sometimes it's just like a bone spur or something like that. Sometimes it can be hardware, screws, things like that are, you know, in the body. And we are not going to be able to really fix that, if you will, but we can help. We can help these patients with some of these problems. And I always say, if you start up next to a CrossFit You know, you got those people are messing their bodies up pretty regularly. But nothing against CrossFit, right? But yeah, you could do really well by that. I often have a lot of patients that will, you know, they have this kyphosis, right? Because they're constantly looking at their computer. They're you know, sticking their necks out. That ends up being a problem that's, you know, it's difficult to treat because the natural curvature in their neck starts to change over time, right? Because there is a curvature in our neck that, you know, we're basically born with, and protecting that is very important, right? And the best you can do is, you know, maintaining good posture and that keeping that awareness. But you know, what happens when you've had somebody who, you know, they did a whole master's degree, so you know, they're in the books, they're in the computer for years, and then they get into a job where they're working 60 something hours a week, again on a computer all day long, and over time that's either gonna make their neck straight or create curvature going like the wrong way, right? Oftentimes when that happens, I will refer out. I'll send my patients. There's some chiropractors that that I found that's exactly what they do. Their whole job, or you know, their purpose really is to help create good curvature back in the neck again. Now, when you're working with those patients, because they should definitely be seeing you as well, but you'll find that, you know, when you're getting all these great trigger point releases in their neck, you know, they're gonna feel great for a few days, and like, oh wow, all this stuff is so loose. I love, you know, feeling that, you know, getting all the range of motion back and all that stuff, right? I feel good. 5 days later, you know, they're locked up again. And, you know, if that person's been coming to me for, you know, 6 weeks or, you know, more, I'm just at that point, I'm saying, you know, look, you should start at least get an x-ray of your neck to check the curvature, and really start looking into that. And that way we'll be able to get a deeper result from our dry needling, and really be able to change, and get, you know, really the goal is to get these people to fully rehabilitate. I don't want somebody to be in this endless cycle where they have to see you once a week forever. I have some patients that need that, where they're really just waiting to get surgery, right? There's some people where you're just not going to be able to fix, right? But there is a lot of good that we can do for a lot of people, just to help them maintain themselves, to help get through the week, because sometimes the structural things, you know, we just cannot fix, but the body, as much as we try to work that situation, the body is still going to try to compensate and try to, you know, keep going and keep surviving, because that's what our bodies are made for, you know, just to keep going and keep moving. Well, but on that note, we're going to take a little 15-minute break and stretch our legs, grab some water, and we'll be back in a little bit. Take a look at this.
Thank you, Mike. We'll
Thank
be
you.
back in 15 minutes.
Okay, thank you.
Okay, that will be at 10:30 Pacific time.
Recording stopped.